Pre-eclampsia. You've probably heard the word, and yeah, it can sound pretty frightening, often pictured as this sudden, violent storm during pregnancy. And while it is a really serious condition, it's also manageable, and even more importantly, often preventable. So in this explainer, we're going to pull back the curtain, replace that fear with some clear understanding of what eclampsia is, how it develops, and exactly how it's treated. So here's our game plan for today. We'll start by defining this sudden storm and figuring out who might be most at risk. Then we're going to trace what I call the domino effect, how this condition actually develops in the body step by step. We'll look at the warning signs, what the emergency response looks like, and then wrap up with the most important part of all, prevention. All right, let's dive right in. First things first. What exactly are we talking about when we say eclampsia? Well, it's known as a critical obstetric emergency, and its defining feature is just how suddenly it can strike. Okay, let's really break this down. The most important thing to get here is that eclampsia is what happens when preeclampsia, that's a condition with high blood pressure during pregnancy, gets so severe that it actually causes seizures or even a coma. That seizure, that's the specific event that takes a serious condition and turns it into a life-threatening emergency. You know, a lot of people think that the danger is over once labor starts, but that's just not the case. While it is most common before labor, eclampsia can absolutely happen during labor or even in the days and sometimes weeks after the baby's delivered. This is exactly why monitoring after birth is so incredibly important. So we know the what and the when. Now let's get into the who, because identifying who might be at a higher risk is really the first big step toward proactive care. As you look at this list, you can kind of see a pattern. Some factors are about the pregnancy itself, right? Like if it's your first baby, your age, or if you're carrying twins or triplets. But others are about pre-existing conditions, things like chronic high blood pressure, diabetes, or really importantly, a personal or family history of preeclampsia. This just drives home why a super thorough medical history is one of the most critical things you do in prenatal care. Okay, now for the really fascinating part. Let's get into the nitty-gritty of this domino effect. This is where we see how a series of events inside the body can cascade one after the other, turning a subtle problem into a major crisis. So domino number one, it all starts with the placenta. If it doesn't develop just right, blood flow gets restricted. Think of it like a kink in a garden hose. So now this struggling, starved placenta starts releasing toxic stuff into the mother's bloodstream. These toxins then go and damage the lining of her blood vessels, which causes them to clamp down. That's called vasospasm, and leak fluid. That leads to the high blood pressure and swelling. And when this whole mess hits the brain, that clamping down and swelling can starve parts of the brain of oxygen, and that is what ultimately triggers the seizure. See? Each domino knocks over the next one. So now that we get what's happening on the inside, let's talk about how it shows up on the outside. These are the warning signs, the signals that the storm is brewing, and recognizing them is absolutely critical. And let me be clear, these are not your typical pregnancy discomforts. We're talking about huge red flags, a splitting headache that just won't go away, seeing spots or flashing lights, or a sharp pain right under your ribs. These are your body's alarm bells screaming for help. They're telling you that the blood vessel damage we just talked about is now affecting major organs like your brain, your eyes, and your liver. And that's the big question, isn't it? If those warnings aren't listened to, or if the condition just escalates too fast, that's when the final domino falls. That's what leads to an eclamptic seizure. The seizure itself follows a very clear pattern. It kicks off with a very brief premonitory phase, just a few seconds. Then comes the tonic phase, where the whole body goes completely stiff. That's followed by the clonic phase. Those are the violent, jerky movements that we usually picture when we think of a seizure. And finally, as the brain tries to recover, the person enters a state of unconsciousness, or a coma. So what happens when this crisis hits? It seems like pure chaos, right? Well, what's incredible is that for such a chaotic event, the medical response is anything but chaotic. It's incredibly structured and clear. There is a solid plan in place designed to get the patient stable as quickly and as safely as possible. The first response follows this universal approach used in a ton of medical emergencies, A, B, C, D, E. It's a systematic checklist. Is the airway clear? Is the patient breathing? Is their circulation stable? What's their neurological status or disability? It's a way to bring calm, methodical order to a really scary situation. During the seizure itself, it is all about safety. The patient is turned onto their left side. This helps with blood flow and prevents them from accidentally inhaling any fluids into their lungs. The team makes sure the airway is clear. And a huge point here is what not to do. You never, ever force anything into the mouth or try to hold the person down. That can actually cause way more harm. Okay, the patient is safe. Now, the number one priority is to stop that seizure. Full stop. And do that, magnesium sulfate is the undisputed champion. It is the gold standard treatment, incredibly effective at getting the convulsions under control and preventing more from happening. Now, I know this table looks a little technical, but it's actually a brilliant system. It's not just one shot of medicine. There's a big initial loading dose to get things under control fast, and then smaller maintenance doses to keep them stable. But look over at that toxicity monitoring column. Before every single follow-up dose, the team checks the patient's breathing, their urine output, and even their knee reflexes. This is all to make sure the dose is just right, effective but not harmful. They even have an antidote, calcium gluconate, ready to go, just in case. It's incredibly precise. So with the seizures under control, the next job is to tackle the severe high blood pressure that kicked this whole thing off. The goal isn't to get it back to normal right away, but just to bring it down into a safer zone. And this is a real balancing act. If you lower the blood pressure too fast, you could actually reduce blood flow to that already struggling placenta, so it has to be done very carefully. Okay, so we've walked through the problem and the emergency solution. But now let's talk about the most powerful tool we have, stopping those dominoes from ever falling in the first place. And this right here, this slide says it all. Look at it. The high blood pressure is there in both. The protein in the urine is there in both. The only difference between severe preeclampsia and eclampsia is the seizure. And that means the entire goal of modern prenatal care is to catch and manage preeclampsia so well that it never gets the chance to progress to that final, dangerous stage. So the big takeaway here is that prevention is an active, ongoing process. Of course, it starts with early and regular prenatal care, checking that blood pressure, testing the urine. But just as important is empowering patients to know those warning signs we talked about and to feel confident reporting them right away. And for women who are at a higher risk, there are even proactive steps like low-dose aspirin that can make a huge difference. So when you boil it all down, preventing eclampsia isn't just about medicine. It's about access and it's about education. And that really leaves us with one final crucial question. How do we build systems that make sure every single pregnancy, everywhere, gets the consistent, supportive care it needs to spot the trouble signs long before the storm ever has a chance to break?